I am Dr. Sharjeel and you are watching my YouTube channel. If you like my videos, don't forget to subscribe my channel at the end of the video. So for the last few weeks I am posting lot of trauma cases, and this is yet another case of a traumatic injury to the eye. This 12 years old female patient had a vegetative trauma. A long sharp thorn of a tree went into the eye. You can see here the entry point in the cornea around about 10 to 11 clock hours, and not only it penetrated full thickness, it also damaged the iris and also caused traumatic cataract in this patient. So the cataract formed within 2 to 3 days, and when the vision decreased, they suspected that the injury is grave and they presented to me. Now here you can see on retro illumination the cataract, the posterior subcapsular flower shaped rosette traumatic cataract. So when they presented to me and they gave the history of 4 to 5 days of vegetative trauma, and there was a thorn and we have removed it, and she was all right, but now the vision is decreased. So when I examined the eye, the entry wound, the corneal wound was self-sealed, the anterior chamber was formed. So I dilated the patient and observed the fundus. Fundus was all right, and the damage was up to the lens. Traumatic cataract was formed, as well as you can see one posterior cynic at 10 o'clock area, and there was a small traumatic ulcer at the entry point of the cornea as well. So I gave him topical antibiotics, cycloplegics, antifungals, and told them that at the moment the eye is okay, the wound is self-sealed, serial test was negative, so we should wait so that the keratitis completely heals, and the cataract you will need cataract surgery, because there is no medical treatment of cataracts. So just imagine the 12 years old kid, female kid, and she will need cataract surgery. Her accommodation will be lost, and you know the consequences of cataract surgery. So if she was using sunglasses, she would have avoided this vegetative trauma. So once again, I am giving a message to all those who work in fields, farming industry. They should always wear protective goggles that should prevent their eyes from getting these vegetative traumas. Sometimes you get aggressive fungal ulcers that are very difficult, very resistant to treatment, and you ultimately lose your eyesight as well. So this patient is lucky that the keratitis is very mild, and hopefully it will completely resolve, but she will need traumatic cataract surgery, lens matter aspiration with foldable level insertion later on, and this injury would have been avoided if she was using protective goggles. So that was today's case. Thank you very much.